Hey, everybody. Welcome to the Kind Intel podcast, where we explore how innovative solutions and compassionate leadership are transforming healthcare operations. I'm your host, Roland Regino. Join us as we talk with industry experts who are redefining efficiency, elevating patient experiences, and shaping the future of care. On today's episode, we've got Jeffrey Petersen, the CEO and owner of Peterson Physical Therapy, with 4 locations in East Valley, Arizona. I believe they're at Maricopa, Tempe, Mesa, and East Mesa. Jeff, thanks for joining us today. Before we dive in, could you give us a quick overview of your background and current role?
Yeah, absolutely. So I am the CEO. I'm also a therapist. I still treat patients, and I've been a therapist since 1984. I grew up in Boston, Massachusetts, in East Boston. Went to college for physical therapy in Maine, Biddeford, Maine, at the University of New England, which is just a little school. They just started their physical therapy program. And when I became a physical therapist, not many people knew what it was, frankly. Most of the therapists worked in hospitals. And so the history is that they started with restorative nurses during World War II. And then the polio epidemic came and people needed to move patients as they were recovering from polio after getting out of those iron lungs. And then it became more and more professional. So about mid-70s, 78, it became a licensed profession or a certification, and then they began licensing. I've seen some changes in the profession over the years. Initially, we were having battles with physician-owned practices. Physicians were owning physical therapy, and that was a big kind of political battle. We've had our political battles with chiropractors. Now, there was a political battle a few years with acupuncturists, and it's all trying to each of the professions trying to maintain their grip on what was going on. And a lot of that has kind of disappeared now. And so I've been working for 40 years, what is it? 84 or 41 years, maybe. I'm not good at math. No one told me math was going to be part of this podcast. And so, years ago, I don't know if you're familiar with some business books, but the E-Myth Revisited, I had the entrepreneurial spasm and I thought, well, shoot, I can do this. I can do it on my own. And I just jumped in. And back in the day, the margins were so wide in terms of what we build and what we collected and what it costs us to do business that it didn't matter how we ran the business. It was just doing a good job and having people come in. Now, as the business side of it got tighter and insurance companies, because it's a really interesting business. If you think about it, I don't have a customer who's paying a bill and I'm out marketing that customer. I go and we market referral sources who refer their patients to us. Then I send a bill to the insurance company who pays a portion of it. The actual customer pays a portion of it. So we really have 3 customers in our business to satisfy in order to continue in business. And it's a very high contact, high touch business. So it gets expensive because in order to be high touch, high contact, you need to have a lot of people. And so just going through the years, we've had success and failures, and we're having a decade of some considerable success, and in large part due to learning how to build a business and build a culture of people who want to work hard but still do a good job. We have a lot of young people working with us now that it encourages me. People will lament, these dang kids in these days. We have some young people that really inspire me and give me encouragement for the future. So I've been doing it for that long. And now we've just started trying to multiply. I've made several attempts to multiply early on in the business and failed miserably. I thought, well, if I open up a location here and we send patients there, we should do the same there that we're doing here, because people will just do what I'm doing. And I'll just tell them, here, you do this and we'll be successful.
Speaking of that success and your expansion across the eventual 4 locations that you have now, it seems like a lot of that, as you said, been tied to your focus on people and, your 3 essential customers. But a lot of it could also be attributed to your approach. And I've noticed on your website that your motto is meet people where they are and help them move forward.
Yes.
Can you speak a little bit about that and how that guides your business principles?
Yeah, I would love to. And the part that you missed is with unconditional positive regard.
Meet people where they are, help them move forward with unconditional positive regard.
Yeah, so we start with the unconditional positive regard. We're meeting someone where they are. It came about as a way to get out of this idea, this narrative that somehow I am a healer. You come to me, and I studied with a manual therapist whose attitude was, I will tell you how you're doing
Hmm.
because I'm the expert. And I realized that I'm not going to heal anybody. Can I optimize the environment so that their pain will be reduced and they can start to move and the tissue will heal? Absolutely. But that's more of an agreement between the patient and me. It's a relationship that we're building. Ironically, it's the same thing building a team. You want to have a relationship and say, okay, what is it that you need? What is it that you want? Where do you see yourself going? Is there a match? And can we do this together? And so that's where, and the other part of it, the unconditional positive regard came in that many people who are in pain feel judged and dismissed because their pain doesn't necessarily follow the pattern that it's supposed to in the eyes of the practitioner. So
Hmm.
they get frustrated because practitioners want to help. And when they get confused and don't know what to do, and it's a complicated, they don't have a foundation from which to back off and say, okay, where do we start? Even the most complex cases that I see, I always start with, can we get you to take one step? If you can take one step towards recovery, then you can take two. As you take two, you can take three. And it's just like
Hmm.
training a baby to walk or training anyone who heard many, many times over the years, anyone who's had a surgery in their lower extremities, I feel like I'm learning to walk all over again. And they're learning to walk all over again. So just like a baby, if your baby's toddling along, I have a new grandbaby and she toddles along and she falls down, you don't look at her with shame and guilt and go, what are you doing? You can't walk. We play hide and seek and she's a terrible hider. Well, she's only
Hmm.
1 year old. She covers her face and she thinks she's hiding.
That's cute.
Not to be presumptuous or look at kids like children, but the essence is to look at myself. Where is my heart in relationship to the patient? And can I have a certain amount of positive regard and just focus on one step at a time and help them move forward? And that's what contributes to healing. So
Absolutely.
that's where they came about.
That's great. How do you continue to motivate the patients? And obviously, as you just said, getting them to do just that one step, one more step, one more step. The motivation of the patient seems like a key part in their recovery.
Yeah,
And
absolutely.
how has that changed over the years?
That's interesting because so part of my history is I went to ASU to study sports psychology in their graduate program. And it was just when the university started pulling exercise science out of the phys ed schools. They were, in the past, all exercise classes were part of the educational training, and it was in the phys ed department of the educational school. And they started pulling it out as a science in and of itself. And Dan Landers was my mentor at ASU. And my research was on intrinsic motivation to persist at a motor task. What motivates people? And there's what's called drive theory, where if a motor task is too difficult, then you get frustrated and stop. If a motor task is not difficult enough, you get bored and distracted. So the
Hmm.
real challenge is, can you design the motor tasks, whether that's an exercise or if it's a tennis lesson or if it's a golf lesson, so that the motor task is not too challenging, but challenging enough that you can see some measure of success. The other thing that I learned was the only two things internally that will generate internal motivation are specific, positive verbal feedback. So it's got to be specific, meaning it's got to be sincere. It can't be, you're a good person. That was a good job. It's, you know what? When you were walking, you did a really nice job striking your heel, contracting your quads, and standing up nice and tall. The other
Hmm.
factor that contributes to internal motivation is locus of control. We live in a culture now where, dang it, no one's going to tell me what to do.
Hmm.
And it's a value that people hold dearly. Now, I've tried to repent of that because it can get in the way, but you need to recognize it. And so we give our patients complete locus of control. If you don't want to do this, you do not have to do this. In my mind, this is the best way for you to be able to take the next step. And we want to help you do that. So by giving people locus of control, specific verbal feedback, and then challenging them in a way that's not too challenging, but challenging enough they're going to see success. That's the best way to create an environment where people will start to become internally motivated. The other motivation is motivation for fear of punishment. And we
Hmm.
don't want to go there. Although I've seen many practitioners go, I've had many patients in my office crying because they went back to see the orthopedic surgeon and he said, "You're doing a terrible job. Your shoulder's going to freeze up and you better get going." And then they come in to me and they're in tears. I'm like, he's used to working with patients when they're sleeping. You need to forgive him a little
Right.
bit.
That's a great point about surgeons. And apologies to all the surgeons out there, but
Yes. I
it
have
could
some great
happen.
friends that are surgeons. They do a great job. I mean, they're
Right.
the kind of guys that you want that have the courage, literally, to cut open a body and put it back together.
Absolutely.
That takes courage. It takes smarts. It takes skill.
Now, speaking of courage, one would say that your journey, when you think about it, starting your own practice in the early 80s, when the profession itself was fairly new, took a lot of courage. And then expanding to now 4 different locations total, that takes a lot of courage as well. Can you talk a little bit about how you were able to leverage your success in one site and then open all of your additional sites? What was it that motivated you to do that? What made you think that you were able to do that? What made you think that you had the capacity and bandwidth to do that?
Yeah, that's a good question. The most candid answer I can give you is sheer arrogance to think that I can do this. I was one of the first in my family to go to college. And honestly, when I showed up at PT school, I was so silly. I didn't realize you had to buy your books. So I spent, I had a little bit of money when I got there from working, spent a lot of it on
Hmm.
the first weekend, and then realized, oh my goodness, in college, they don't give you the books.
Hmm.
That's how little guidance I had getting into college. So I had a certain amount of arrogance and a certain amount of, hey, I can look around and I can look at the guy next to me and thinking, if he can do it, I can do it. So
Hmm.
part of it was ignorance, part of it was arrogance and a high risk tolerance. Now, I don't recommend that. And I see young people now that work with us and they're goal oriented. They know themselves. They know their strengths. They know their weaknesses. So it was either the grace of God, it was some guidance from men that I met along the way. I've always had
Hmm.
a mentor in high school. That's how I got into PT school. In college, that's how I got out to Arizona and into graduate school. The first thing I would say is have a coach. And it's okay to change
Hmm.
your coach at the different seasons of your life. And it's okay to have a coach in different areas of your life. Back in the day, I remember studying Yohare's window. That's how old I am. And it's a psychological concept for leadership. And it's, there are parts of our life we see, but no one else sees. It's kind of the
Hmm.
secret parts that we keep to ourselves. Parts of our
Hmm.
life that others see that we don't see. Part of our life that we see and others see. And then there's part of our lives that are completely secret that only through some divine revelation will anybody ever see. And the aim is to kind of integrate those windows so that it's as transparent as possible in all those areas. And to translate that to someone that has a gait problem, some people can feel pain. That's a part of their experience that they feel that it's really hard to articulate that no one else might feel. And then
Right.
there's part of the compensation that a therapist can see that the patient can't see. And then there's part of the compensation that they can see and the therapist can see. And the aim is to try to help the patient integrate all of that so
Hmm.
that they can work towards whatever the goal is and most of the times it's to get out of pain and to improve their function.
Right.
So I don't know how I got there, but so in terms of going to opening up different offices, the other part of it was I was not afraid of failure. I've opened and closed more offices, probably 12 different offices. And I'd open an office and we'd work and it would fail. And I would have a coach say, that office is costing you $8,000 a month. Do you think it's worth keeping open? And to
Hmm.
be able to have to set my ego aside and say, I'm going to chalk this up as a failure and I'm going to close that office. And so it was trial and error, arrogance, ignorance, but definitely having coaches to help me along the way.
That's a great segue into the next question, which is opening the offices is a major accomplishment in itself. But I think it's just the beginning, right? And the hard part is keeping those offices open. So
Absolutely.
as you open those additional offices, how do you ensure quality and consistency and obviously success in order to keep those offices
Yeah. And that
afloat?
was a journey. That took me a decade to learn.
Hmm.
Initially my attitude was I fell into the Bill Belichick mode of coaching. Do your job, shut up. We're not going
Hmm.
to have fun.
Hmm.
And then I realized that that doesn't work, particularly with professionals that are motivated in and of themselves. So the real key is to to find the right people. And in our case, it's obviously they have to have certain credentials, but the credentials in my mind is one of the least important parts. It's having the aptitude to learn, having a teachable spirit, and having a general kindness towards others and wanting to work as a team. And like I said, willing to learn. And
Mm-hmm.
so really selecting the right people, getting them in the right seats, as Peter Drucker says in his book. When I read that book, I was like, yes, this is what I'm missing. And then really spending time building those relationships to make sure that people are, I see my job now more so feeding the team and let them take care of the patients. Although I
Mm-hmm.
still take care of patients because it's what I do. I like to do it. I do it well. And it's hard for me to kind of pull back from that. But
Mm-hmm.
I have started dividing my time as my job is to really to encourage and to educate and to feed the team so that
Right.
they can serve the patients. And shoot, you get the right team, you can have as many offices as you want. And then obviously building a structure, because
Right.
young therapists come in and they've been taught in PT school, but they don't necessarily have a structure to be able to deal with all the stress that comes from working with people that have pain. I
Mm-hmm.
mentioned earlier, we were discussing before we got on, when I was in PT school in 1983, I did a report and I did a review of literature, and the average length of time a PT stayed in the profession in 1980 was 4 years, and then they quit the profession completely. Well,
Mm-hmm.
what's happening now is uh, in the keynote address from the American Physical Therapy Association president in 2020, the big issue with therapists now is they owe 150, 200 grand from school, and they
Mm-hmm.
can't just quit their job. And so how do you reconcile that when suddenly you have a young, enthusiastic therapist out of school and they go, oh my goodness, it's not as easy to help people as I thought, but I have to
Right.
work and so to help people find the meaning in meet them where they are, help them move one step forward. And that's where you're going to see the success.
Right. And speaking of your team again, and it sounds like as you've expanded, you've moved into the player coach role, and to go to your Boston roots, you've gone the Bill Russell route.
Bill Russell.
Or
Oh, well, he did coach.
I think you're probably more successful than him. I'm wondering, as you're finding the right people, and as you said, it's not just the merit, not just the education. It's more of your capacity for helping people, for ability to learn. How does that go into staffing each of your locations? And can you talk a little bit about how many folks and what the structure is at each of those locations, and whether you've got an overarching structure managing the entire network?
Yeah, so we have an administrative group that does billing, collections, marketing, account payables, account receivables.
Hmm.
The Mesa office, we are a partner. David Call and I are partners in that office. He's the primary clinician. He has a
Hmm.
PT, a PTA, and a technician and a receptionist. And then we do all of his admin. In our Maricopa and Tempe offices, we have 3 or 4 clinicians in Maricopa with technicians and about the same here in Tempe. And we're really busy. I mean, the limitations we have in each of those offices, frankly, is the space that we have, because we
Hmm.
have more demand for people to come in than we have space. But then space is another issue. Those are one of the costs. Our collections today per visit is about 35% less than what it was in 1993. Yet our rent, our taxes, our salaries, our insurance has all gone up. So the margins are tighter than they were when we started. Really managing the finances has become something that I've had to learn over the last couple decades. So it's not a problem, but it's a different skill set than most physical therapists have. You don't go to PT school or even medical school and go through P&Ls and balance sheets and know the difference.
Hmm.
So having to learn the numbers as a way to be able to say, because our business is high touch. So we need people there. And you may get into this, one of the things that is coming down the line in terms of the future as a way to save expenses is to have a virtual assistant in the front desk. So someone comes in, they check into a kiosk and you collect their information, they get registered, they get seen by the therapist. And you can
Hmm.
have a virtual assistant manage 2 or 3 different offices.
That's
Now,
a
looking at our patient load, you look at the demographics, in another 20 years, everybody's going to be used to the kiosk because everywhere you go, there's a kiosk. But everywhere you
that-
go, you see the old gray haired guys like me going, oh, dang it. What, grumbling about the dang kiosk and, slapping buttons. And
yeah. And there's always somebody readily available to ask you
Yes.
if
So
you
you
need help.
still need, but you notice it in the grocery store now that there's
Hmm.
more and more self checkout, obviously, because people are more expensive than having a machine do the work. So there is a balance there. It's certainly coming down the road. We have not
Hmm.
embraced the virtual kiosk, and I don't know.
That's a good point, and maybe we'll get back to that, circle back to that later. But I wanted to kind of dig into a little bit about your current operations and challenges. Obviously, you're talking about the structure, you're talking about how you ensure that consistency and quality across multiple locations. And it does sound like there's an administrative structure that kind of oversees some of those tasks across multiple locations. Are there specific challenges with owning and operating four different locations that are taking up the most amount of your time right now? And it sounds like space is still an issue, but how about in terms of handling the patients, receiving the phone calls, paperwork, et cetera? What is the major challenge for you and your staff right now in terms of day-to-day operations?
Yeah. So for me personally, it's switching hats. So fortunately, I'm kind of ADD. So I can work with a patient. I can do a couple different things at one
Mm-hmm.
time, but I have my limit.
Mm-hmm.
And so I can switch two hats. Okay, now I'm a clinician. I'm going to be attentive to the patient. I'm going to put all my mind and heart into how can I help this person make one step forward. I'm
Right.
going to eliminate whatever stuff I'm dealing with personally so that I can meet them with unconditional positive regard. Honestly, sometimes that's a challenge because people in pain are needy
Mm-hmm.
and they need attention. I dare say they need some measure of acceptance, affinity, love, whatever word you want to put on it. People in
Right.
pain have needs. And so
Mm-hmm.
each interaction, you're giving of yourself, and that takes a certain amount of energy. And then to shift to be able to change hats to be, I'm an employer and I'm dealing with an employee, a team member that is also needy.
Mm-hmm.
They have needs, they have families, they have challenges, and I may get too involved in some of that. I've had some business coaches that are ruthless. Jack Walsh was known for, hey, you got to get rid of 10% of your staff every year. I
Right.
may be loyal longer than I might be, but when you have a relationship, so I can do two hat changes, but then to take a third hat change where I have a vendor, then I'm like, okay, I've reached my limit. And so fortunately, I have a team. My vice president of operations has been with me 20 years. She's solid. I've had employees steal money from me.
Mm.
I trust this woman with my finances. My numbers are spot on. 2 weeks after the month closes, I've got the numbers. Every quarter, we get the numbers. So to have people that you trust, that you can delegate, that I can trust, that I can delegate to, that have bought into the vision, that have bought
Mhm.
into the promise, that not only apply that promise with unconditional positive regard, we apply that to our team members.
Right.
Now, what I have learned is sometimes to help them take a step forward is help them take a step out of our company. And that's okay. I have a really good friend in Hawaii. You mentioned Hawaii. So if you ever
Mhm.
need therapy in Hawaii, I know a great therapist in Hawaii. He was on our team. He took a step out of our practice and it was a good step for him. And I still love him and we still connect.
Mhm.
Sometimes you have to encourage him a little firmly to get out. But so to not be afraid to build the culture and then move people to places where they're best fit. And if that's not with us, then help them find their next position.
Great. Now, as far as connecting with patients and meeting patients where they are, one thing I've noticed about you and your company is that you started to put out videos, educational videos on YouTube. Now, for the listener, these are great videos. I myself got sucked in. I was watching a few last night. Uh, the joint pain, avoiding joint pain, I thought was exceptionally helpful. But Jeff, can you talk a little bit about how what your approach is to these videos, and is it geared towards educating patients so that rather than treating them as they come into the office, you're hoping to prevent some of those injuries in the first place?
Yeah, absolutely. I mean, prevention is always better. But even before prevention, we all have some measure of pain, discomfort. Fatigue is kind of the early sign. So years ago, we were doing a lot of injury prevention in the workplace.
Hmm.
And the key to prevent workplace injuries is to recognize when certain areas are feeling fatigue before they feel pain. What happens is people get focused on the task at hand. They feel a little discomfort in their neck and shoulder, and they say, well, it's not too bad, so I don't need to make a change. When that's the optimum time to make a change, because a little change will decrease the fatigue, will increase the tolerance of that tissue. So trying to prevent the injury is really way better than treating it. And then if there is an injury, people have more awareness. One of my driving, if you will call it a vision maybe, is to know myself, with God's help, to know myself. Well, part of what I've learned is that when I first heard that 40 years ago with my college mentor, I thought that was kind of knowing myself emotionally, knowing what I like and dislike. What I've learned over the years is it also includes knowing where my body is in space. Do I have kinesthetic awareness? And some people they don't know where their body is in space. So if you can increase that, you can prevent injury, but you can also, if there is an injury, you can optimize the environment for healing in a much easier way, because the person has some awareness of where their body rests when they're sitting, where their body rests when they're sleeping, when they're working, when they're performing work. They have athletes have this really keen sense. I just treated a woman yesterday, 51 years old. She's now a fitness trainer. I saw her 18 years ago when she had a severe fracture of her pelvis. To look at this woman, 51, she's really fit. Well, her glutes just are not firing. She's got great quads, really tight hamstring, but her glutes just were not firing. She could not feel she could feel a lot of other stuff. So someone like that is like easy peasy, man. You get right in there, we focus on the glutes. Some people, it's a target-rich environment because there's just no awareness of where their body is in space. And our bodies are designed, if you think about pain defined by the International Association of Study of Pain, unpleasant sensory and emotional experience associated with actual potential tissue damage. So it's an emotional experience associated with maybe tissue damage, maybe not tissue damage. So emotion can feed into that. And then you add to that a lack of kinesthetic awareness. And sometimes the one step forward is, can you feel your shoulder moving? And that's enough to wake people up, and you take it one step at a time.
No, I think it's a lot of great information. And it kind of leads me to the next point here, Jeff, is that considering your success over a number of years in the field and your approach of meeting patients where they are with unconditional positive regard, it seems like all of this would probably fold in nicely to the book you're writing. Would you mind telling us a little bit about that?
I've had this conversation about pain. I don't know how many times. I like to count things. So I kind of estimated I've probably treated 15,000 individuals in 40 years. And when I say treated, I mean sitting face to face like this for a good amount of time, touching them. I often joke, if I were afraid of armpits, groins, or feet, I would have a different job. So you're in there, and there's a level of intimacy when you allow someone to touch you. And so having this conversation, you mentioned the videos, part of the frustration I have with the videos, you would mention the videos, is it's only a short amount of time. So I have a guy that helps me do that, Jeremy, he's awesome. And he'll come up with, and he'll be like, okay, we got to focus. We got to focus on what's going to be the most helpful. We only have 3 to 8 minutes. Okay, what can you do about this topic within this amount of time? So, and that's kind of how it is with the patient too. I can't go into the whole conversation. So I thought what I don't need to do, but what I want to do as I get older is I want to write down the conversation that I've had with patients, those 15,000 patients over the years around pain. And it's called the shadow of pain because we live in a shadow of pain. Everybody has some pain. Nobody gets out of life without pain. And so how do you deal? What if the International Association of the Study of Pain defined it as an unpleasant emotional experience? What are the common elements in dealing with physical pain? A sprained ankle, a knee, or your spouse just died? The process is amazingly similar. I remember reading about, do you know Bernard King, that name? Yeah, so he was a basketball player for the Knicks. He was going to be Michael Jordan before Michael Jordan. He was going to challenge the Celtics because he was really good. He was like a prolific scorer, blows his knee out, teenage 3, 4, 5. Now, keep in mind, back in the 80s, all the doctors wanted to do knee surgeries. There was probably 15, 20 different procedures you could have. they'd move the patella, they'd, do osteotomies, all this stuff. None of it worked. They kind of settled in on knee replacements are good, ligament repair, and ACL surgeries are really good. So I don't know what
Mhm.
kind of ACL surgery he had, but back in the day, they did not do early mobilization. They did a lot of immobilization, but he
Mhm.
describes the story as trying to get down to his kitchen to get a glass of water and scooting down the stairs and just being in tears because his knee hurt. And I'm
Right.
sure you add to that the pressure of, am I ever going to, all the emotional stuff that would go along with it with a professional athlete. And so be able to, those are our patients. They've got the emotional side, they've got the physical side. And though we want to compartmentalize it in our bodies, it's all the same. So working with patients, it really is about trying to navigate triage. Where are we right now? Very rarely. And there you have patients. My knee hurts. It's stiff. Show me a way
Mhm.
to get or this woman, show me a way to get my glute going. And she's going to be 3 or 4 visits. She's going to be fine because she'll
Yeah.
get her glute going.
In your mind, what do you see as what could be in the future of physical therapy? Now, you mentioned the automated kiosks. Are there other aspects of technology that you think are going to positively impact the physical therapy profession or your day-to-day operations?
Yeah, absolutely. And I think where technology can be the most helpful is in our documentation
Hmm.
and in our billing and collections. You'd be shocked. We have so much data in our billing and collection system. Like I would want to be able to walk up and say, tell me how many Blue Cross Blue Shield patients we've seen in the last 6 months that have completed their treatment plans, and how much did we get paid per visit on those Blue Cross Blue Shield plans? That seems simple.
Hmm.
It's really challenging. It takes many, many steps. Now, there are some companies that are working towards that, but then they have
Right.
other weaknesses. So it's combining that with the ability to, when I started, we literally hand wrote all of our notes
Hmm.
and typed all of our evaluations and progress notes. And then we got to the point where we were dictating them and we'd give a tape to someone and they would type them and bring them the next day. To 2005, right in there, we went to a digital electronic medical records. And so we've seen the miscommunication between the documentation and the billing, between the
Hmm.
billing and the finance system, and then our productivity. And we are still using several different systems to bring it all together. Now, there are companies that will promise that, but I feel like with AI and technology that we're in the VCR beta max time, you know what I'm saying? And I
Like
feel,
like Laserdisc.
yes, back in the day when they're like, oh, you can watch movies all these different ways, and so it's like, okay, well, some of it's going to wash out. Some of that cream's going to rise to the top, and there will be a much easier systems. Billing, collections, marketing, electronic medical records is the first area. In the clinical area, I could certainly see where you would log on and a virtual doctor pops up, takes your history. You could even do a blood pressure, heart rate, respiratory rate, and he would prescribe medication for symptoms. And keep in mind, I love my doctor. He's great. There won't
Hmm.
be the personal connection, but it'll have all the data that is necessary that AI can go access. But you're going to miss that human connection.
Yeah, based on everything you said today, obviously that human connection is key, and it is again a driver in your business and a driver for your success over so many years and decades of your work. So, with that, Jeff, I'd like to thank you so much for your time today. You've been very generous
Oh,
with
thank you.
sharing all of your insight and your expertise, and I'd like to encourage everybody for more information about Peterson Physical Therapy to check out their YouTube channel, and we'll provide links to the office as well below in this podcast. And be sure to look out for that book, Shadow of Pain, due
Yeah.
out early next year. So with that, thanks again, Jeff Peterson, and all the best.
Thank you, Roland. Appreciate it.